Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone. Welcome back to another episode of Coaching Healthcare Leaders. So I am your host, Dr. Lisa, and today I have with me another amazing guest. So I will be interviewing today Dr. Sandy Balwan, and I'm going to read her bio first, and then we're going to get into some questions and learn all about her leadership journey. So, Dr. Sandy Balwan is the Chief Medical Officer for Northwell Direct, a direct to employer company affiliate of Northwell Health. In this role, she is the lead clinical sponsor for the program and product development, and also is responsible for quality improvement, health outcomes, and efficiency with a focus on the employer population. Dr. Balwan also serves as Senior Vice President and Executive Director for the Northwell Health Clinically Integrated IPA and is responsible for executing Northwell Health's value-based care programs across its clinically integrated provider network. In this role, she partners with both internal and external stakeholders to achieve quality and manage the total cost of care for defined patient populations tied to Northwell's value-based contracts. She is an associate professor of medicine at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell and maintains an active clinical practice. Dr. Balwan joined Northwell Health in 1997 after completing her medical degree at Mount Sinai School of Medicine. So welcome, Dr. Balwan. I'm so excited for you to be here today.
Thank you, Dr. Herbert. It's a pleasure to be here. Thank you for having me.
Absolutely. So I'm just now realizing that we have New York roots in common.
Really?
Yes, yes. So I was born and raised in Brooklyn, New York, and did my undergrad, sorry, at Stony Brook University.
Okay.
Yeah, right,
Yes.
in Long Island.
Yeah.
And then I went to med school at SUNY Upstate. So yeah, so New York is definitely in my veins.
Oh, very nice. Very nice. I'm glad to hear that.
Yeah. So we'll get into some questions. I really want to learn about, and if you can share with us, tell us a little bit about your leadership journey and who or what may have been instrumental in that decision.
Sure. Thank you. So, I immigrated to the United States from Georgetown, Guyana. So I'm Indo-Caribbean. So that will to share a little bit of flavor and to give a little bit of insight into who I am and why I'm the way I am, and my character traits. So immigrated when I was 11. I just turned 11. So came into Queens. So you're in Brooklyn. I grew up in Queens, and went to Hillcrest High School. Being from immigrant parents, they didn't want you to go too far. They were afraid for you to take the bus, and all that was kind of projected toward you. So I went to the local zoned high school, and luckily for me, they had a pre-medical program. So I did the pre-med studies there, and I realized I liked it, and I was pretty good at it. It wasn't extremely difficult. And after that, I got accepted into a combined BSMD program. So with City College first for my undergrad, first 5 years, and then the final 2 years at Mount Sinai. So in New York City. So that's how I got started in medicine. Kind of found my passion, found that perfect sweet spot of what you're good at naturally, what you feel that you can contribute to society, and also getting a foothold on that career path. So and then after that, I had my first child. I'm actually doing medical school, and so did a residency training at Northwell Health. And then I did the chief residency year after I finished my residency program. And then I joined as the director of the medicine clinic for Northwell Health. And since then, it's been a little bit of maneuvers here and there, but here I am today.
Great. Thank you for sharing that story and also for sharing your background as well. So, living in Brooklyn, it is a huge melting pot. So, I had a lot of friends from the Caribbean, and yeah, so thank you for sharing that. It brings back memories of Carnival and all, and all those things
Yeah.
that we used to also, take part in New York.
Of course, I think it just influences how you interact with different people and what you meet people from all backgrounds, and it really shapes your understanding of what people need as clinicians, and what you need to do to get them to adhere and follow what you're recommending.
Yeah, yeah, absolutely. So you gave us a little bit about, your backstory in terms of how you got into medicine and how you ended up at Northwell Health. So tell us a little bit about the day in the life of what it looks like for you in your leadership role that you currently have. Who do
So
you serve and what challenges do you face?
so it's a balancing act. So as you said, thank you for that very generous bio. It's a balancing act. So first and foremost, my patients, I said I still clinically practice. So I'm always, checking in on them, responding to things that they may need. And I see patients 2 half days a week. So responding to that, that's first and foremost. Second is providers and employers. So for providers, I run their IPA, so needs they may have, and also helping them. The goal there for me is helping them maintain independence so they can remain serving the communities that they reside.
Mm,
So that's really important. And we know that healthcare is local. So if we can support providers in their communities, they will be that much more prepared and willing and able to serve their communities. So that's really, really important, helping them stay. We do a lot of population health, and a lot of providers don't understand the concept of. I should say they don't understand. It seems overwhelming to them. This concept of population health. They
yeah.
don't have the jazziest EMRs or the time to keep up to date with all the changes and the regulations. So what we try to do is make it easy for them so they can and break it down to them in a manner in which they are practicing population health without even feeling it or having the administrative burden of doing so. For employers and their employees, Northwell Health is the largest private employer in New York State. So we have one for Northwell Direct. One of our biggest Northwell Health employees is one of our clients, if you will. So we're both the provider as well as the consumers. So ensuring our employees get the care they need, the access they need, appropriate care so they can manage their chronic conditions. And also the same thing applied to our commercial clients. So making sure that everyone, again, getting information to the target audience, making sure that information is digestible, manageable, helpful. We can put a whole bunch of stuff out there. If you don't break it up and get it to a manner that it can resonate with people, then it's a lost cause, and all that effort would be for naught. So really, really getting people and focusing on messaging that you think will one, affect a good amount of people, so the prevalence, and also meet them in that way in a manner that they can actually action on that recommendation.
Yeah, yeah. So you do have a full plate. You do have a full plate. And I think there are a lot of things I took away from sort of, what you do as a healthcare leader. One is that, we can still balance practicing clinically and also having a leadership role, right? If we so desire. So I think that's important for a lot of physicians to know that, and other healthcare leaders to know that you can still practice clinically if you choose to do so and still be able to have a leadership role as well.
I think it's actually necessary
I was
for you
gonna
to
say,
practice.
thank you. And share a little bit about that, please. Yeah.
So how do I go to tell a provider that they need to do X, Y, and Z if I don't understand what what it entails to do X, Y, and Z? How do I know what pushback they're going to get from payers, from patients? What are the challenges and hurdles unless I've walked that shoes and I continue to walk in that shoes? So it gives you a lot of credibility, and it's leadership
Mm,
by example. That is my mantra.
yeah.
It's what I've discovered by myself. I am most comfortable when I can say to you, I understand what the challenges are, and I can share with you what were the workarounds or the way I navigated them as an example and as opportunity for you to learn from what others are doing. So
Yeah.
I feel it would be very, very disingenuous of
Mm,
me to ask someone to do something that I A may not be willing to do myself, or I do it every day in and out. So when I ask providers to ensure that their patients are getting mammograms, I'm an internal medicine provider. You're an internal medicine provider. I understand that patients may go to their GYNs, but it's still our responsibility. Convincing patients to go to colorectal cancer screening. I understand it's a hard sell, but it is still a responsibility, and it's something we need to do and keep honing that in and honing it in. 'Cause that is our role
yeah.
as providers, is to be teachers, to be advocates, to be conveners, to be navigators, because there's so many challenges, and people are at different stages of their life. They can have an overwhelming, story going on at home that
Yeah.
they can't focus on what you're asking them to do. So as clinicians, you need just taking that, reading your cues,
Mhm.
knowing your audience, reading the cues and meeting them where they are that day, so that you can be measured in your approach and get some success. So I think not being in that role, it sounds like, hey, you're just somebody in a suit and bean counter who's telling me to do this, and you have no idea what you're talking about or how difficult it is. We can actually say that yes, we do, because we do it just like you, and the same
Yeah.
challenges you're encountering, I encounter them every day. And these are some of the ways that I approach it. Let's talk about how you can approach it and what are you using for your success, and let's share those success stories. We can all learn from each other.
Yeah. I agree. I think, you said it so beautifully. Leading by example is so important. I mean, that's how you influence others, right? To kind of take those steps to do the things that you know will help to make an impact on the lives of patients. And I think that's also why it's important for us to have, physicians in leadership roles because we have walked the walk, right? And
Right.
we do understand the challenges. We understand, some of the things, the obstacles sometimes that may be getting in the way of, delivering that excellent patient care. So who better than someone who's been there, and done
Yeah.
that?
What is that saying? Be at the table or be dinner. Some variation of that, but
Some
basically,
variation of that. Yes, I love
yeah.
it. I love it. So you told us a little bit about, some of the work that you do and how, through this IPA, you're supporting providers. So, how would you sum up how you best support your team? Like, what do you find that's helpful when it comes to, having to influence maybe physicians and providers, or how do you find it helpful? What's some of the things that you use to enforce or to kind of, bring collaboration to the table?
For providers, and even for clients, for our employers, it's really understanding what's at stake for them
Mm,
and what they can do. So for let's say for providers, for example, explaining to them why it's important first. So, we grew up with value-based care and pop health. These were, for a lot of providers I work with, they're not fresh out of medical school. And when we went to school, they're mid-career or late career. This
yeah,
was not taught. The
yeah,
Affordable Care Act was not passed at that
right.
time. So there are a lot of concept, risk adjustment, things like that, that they are just not, it's foreign to them. So explain to them the why it's important and what it means. And I always find that when you bring it back to the patient, why
Mm,
it matters to your patient if you drop the right diagnosis code. Because it's like, it doesn't change my decision making.
right.
If they drop, they've got diabetes with nephropathy, or I just say they're diabetic. I know what I'm doing. It's all in my head. You know, why do I need to document it? It's extra work. But if explaining to them the why and the outcome of those actions, that really helps, I think. So anticipating their question, explaining the why, and then the how. How do you make this easy for them? So I've got providers and employers with like a million things to do. They've got me. I got to do my elevator speech. How do I get that elevator speech in to capture that audience and then having them ask for more? And
Mm,
again, knowing your audience, I can't, boil the ocean in this one conversation. But let's take
yeah,
a little bit at a time. Let's work. Let's talk about this today, and then leave room for questions, and also supplying data. And again, cheat sheets. simplifying to the job aids. I know what it's like to be in a busy practice. I can go
Mhm.
through the workflow step by step and like, no, we're not going to ask your front desk to do 500 things because we know when that line is long for patients is to sign in
Yeah.
and get registered and to declare that they're at the appointment. That the person sitting at that front desk is very, very much involved in getting move in throughput, getting that patient in and out and getting to the next client. So you're not going to burden them with 10 different tasks. So just knowing the practice workflow or understanding the challenges that practice would face is really important. Understanding that they don't have, you know, a full complement of staff. It's probably them and their probably even their spouse who's the,
Mhm.
the old bookkeeper term and the practice manager and knows the business. So it's really just putting yourself again into what their challenges are day in and day out and trying to understand them, anticipate them, understanding question and being helpful, boiling things down to them. I always say when I communicate to providers, it's 3 bullets. A little paragraph with 3 bullets because we know we lose them after that.
Yeah, yeah. Yeah, that's great. And I think, you said one term that really stuck out, which was elevator pitch or elevator speech, right? Because,
Mm.
we only think about that in a business sense, like when you're trying to promote your business, make sure you have your elevator speech or your elevator pitch, right? Because we know that we have to capture somebody in that first like 60 seconds, right?
Right, right.
So using it in this context as well, I think is great, is brilliant. What's your elevator pitch or your elevator speech when you're going in to talk to your team so that you capture their attention right away?
100%.
Yeah,
Yeah.
yeah,
And a lot
definitely.
of these providers are businesses too, they've got,
Right.
that's the other thing. They've got the lights to pay, the
Yes.
staff to pay. So just anticipating that.
Yeah, yeah. So tell us a little bit about, what do you see as some of the challenges in healthcare? We talked about sort of the work that you do and how the IPA, which I love, the IPA, I think is so instrumental in helping individual practices. I know when I was practicing, I was part of one as well. And it was like, the thing that kept me going,
Yes,
right?
yes.
So, what are some of the challenges though that you see in healthcare, and what are some suggestions that you think we could make in order to, either one, make sure that practices survive, but two, also make sure that we're delivering excellent patient care?
I think a lot of it has to go back, and I don't have a solution I definitely don't have a panacea for this. But I really think we all need to focus on what matters to this patient. Our healthcare system is overwhelming to people to navigate. And it's not a knock on our health system. We have a great healthcare system, but it is a lot. And I don't think there's necessarily a good match to the patient's life or patient's life and what their needs are. So if I have someone who's working a factory job, for a labor union, for example, they can't, they're fixing the roads, let's say, or working in a building company, cement
Mhm.
company, or whatever it may be. They don't have that luxury of time to be able to sit on the phone and make phone calls to get connected to somebody. They don't have that. So how do we make it so that people can have the right access in a manner that works with their lifestyle?
Mhm.
So we've come, we got urgent cares, we have on-site clinics, things that make it a little easier. But for the entire population, one, make it user friendly so I can call and get an appointment.
Yeah.
Two, an appointment that works for me, so I don't have to take a whole day off. That's the thing that people don't also realize is that if I take that half day off, that's a dock in my pay, or that's
Mhm.
fitting into my my PTO bank. So just understanding how we can meet them where there are access, and then breaking it down for them. So I always admire people that speak very eloquently and them day to day, and but when we have patients and we speak with patients, you have to come down to their level. How do I
Yeah.
tell someone that they have an elevated white blood cell count if they don't even know what a white blood cell count, what,
Yeah.
what a white blood cell
Right.
is? So I can say, you got it, and I can just talk about it, but I didn't do my job. How do I tell somebody they've got bursitis? If what's a bursa? Bursa who?
Right. Right.
How do we explain this to show them that this is what happens? So I think that's the biggest challenge: access and communication at a level, and it's not education. I want to make that clear.
I
It's not
love
level
that.
of education. It's you could have people with PhDs, in I don't know, in chemical engineering, not necessarily understand what's going on with their body and explain to them. So again, getting that message across to patients and, using that hook of why it's important. So nobody likes to go on medications,
Right.
right? I have to be on medications forever? Yes, and here's why.
Yeah.
Because luckily, we have a system that you came, we detected this early, and just yesterday I had a patient who was was diagnosed with breast cancer last year, and very like PTSD for her.
Mm.
And I said the good thing is that we caught this early.
Right.
I know it's not great that it happened, but this is why we screen so
Right.
we can catch things early. So
Right.
instead of you got a cure now, you're on the right treatment. You had a lumpectomy, that was it, and you're on a pill every day for the next couple of years. But that's it. You didn't
Right.
have to go to chemo. You didn't have to make all these visits. Your family didn't. This is done for you,
Right.
practically done for you. Had we not caught it early, it could have been metastatic, and in which
Right.
case there'll be a lot more involved. So yes, same thing with colonoscopies. I love colonoscopies because they're both diagnostic as well as therapeutic. They find something, they can take a sample of it, dictate your scheduling for the rest of your years, and also do something about it right
Right.
then and there. And that, versus metastatic colon cancer, I'll choose the colonoscopy. Bring it on. Let's do it.
Yes.
As
Yes.
soon as possible because it means it can change your life. And the other thing that I find that helps me in when I'm trying to persuade patients and anyone, employers to adopt preventive services is it's not just about you. You got
Mm.
a family behind you. That's the hook for me. That's the most successful hook for me.
Yeah.
And especially for mothers and women,
Yeah.
women, what is our worst fear? That our
Mhm.
family is not taken care of. We're not here because we do so much for our families, right? Well, that is our worst. Ask any woman, any mother, what's their worst fear? That's probably number one. So when you phrase it and frame it as such, that listen, this is not just about taking care of you. It's not being selfish. This is taking care of you so that you are there for your family.
Right.
So you're around because we know how important your role is. So I want you around. I want you to be able to benefit and enjoy the fruits of all your labor and have a long, healthy life and be there for your family. That is usually the persuasion I get the biggest response from because people just stop to think, you know what, if something happens to me and I'm not around, and then you see that, you see,
Yeah. Yeah. Definitely. It's looking at it like you said, based on what's important to them and then sort of moving the conversation in that direction.
yes.
Yeah.
And I think
Yeah.
as women, we have we walk the talk, we walk the walk, and we talk the
We'll talk.
talk. And so it really, really matters coming from. And again, I don't want to sound like this is all about gender, but for women, I have a obviously I'm biased, but I think the role women play in their family is so important.
Mhm.
It is so important. So we have to prop them up and so that they can continue to lead their families.
Yeah, absolutely. Yeah. Yeah, they are very crucial. They're the lifeline, right, to how the entire family receives care.
Yep.
Yeah.
They're the
I
ones who schedule all the kids'
I
appointments
know.
and the husband's appointments and everything else.
I was gonna say sometimes the husbands even come in with the children, but they're still on the phone,
That's right.
with the moms like, "Okay,
Because
what do you
mom
want me to
can't.
ask?"
That's right. That's because mom couldn't take off, but she's there the
Well,
best
she's
way she
there.
can because she knows that question that needs to be answered probably wouldn't get asked.
Right, absolutely.
So women, we're like, this is the thing about women, we're like the chief CEOs of our family.
Yeah, yeah. Absolutely, absolutely. Yeah, so I love that. I think definitely I would agree that, 2 challenges are access and communication. And the communication is huge because we have to communicate, always keep in the back of my mind that, and someone's told me this or I've seen it several times, you always want to try to communicate at a sixth grade level, right? And not because you think that the person can only communicate at a sixth grade level, but at that level, you make sure that you're not talking and speaking in a lot of jargon and that hopefully that your message is able to come across. Yeah, and they're able to understand.
100%. And even if the other thing is getting the caregiver or the family to support. If you can reach
Mm,
out to a family member, because the other thing you can communicate, and you know this, but that patient is not hearing.
yeah, yeah,
They can't because they're so overwhelmed with emotion. They're not processing what you're telling them, even if you
right,
tell it to them at the sixth grade level. It's
right.
all great to have someone else there that you can just communicate to, and it's so well appreciated, both
Absolutely.
from the caregiver and from the patient, because they know they were there, they were present,
Right. They know what
but
they heard.
they know there. But it's like going home when it's a just different level when the emotions come in, which are inevitable. It's very difficult to really process what you heard.
Mm-hmm. Yeah, absolutely. Absolutely. So, as we wrap up, what three tips can you offer our listeners on thriving in the face of adversity as a leader and also, just making sure that with our busy schedules that we also just take care of ourselves as well so we can continue to do the great things that we need to do to impact our patients and our communities.
So I would say, be true, staying true to yourself. So we all have our own moral code, things we're willing to do, our own ambitions and aspirations. I think if you're true to yourself and never compromise what's important to you, again, family being first, never forgetting where you come from,
Mhm.
right? Really, really important. Where you came from is what got you here. So
Yeah.
being grateful and going back and paying it forward, as well as thanking those that got you there,
Yeah.
and paying it forward. Paying it forward is really, really important. But staying true genuine to your goals and who your authentic self, being your true self. And I think when you do that, it becomes enjoyable and it also becomes easy. And it kind of it's like a snowball effect. You
Mm.
do more and then you enjoy it and then you do more and more and more. And it takes on a life of its own. And you only put a little bit of activation energy into it. So I think being true to yourself is like the most important thing. Find something, something you're passionate about. It doesn't have to be this overwhelming passion, but something that resonates with all the secret sauce. That you like doing it, that you do good to the community by doing it. It supports you. It's chicken soup for your own soul.
Mm. Yeah.
That's really important. And if you have those things, it doesn't seem like work. It
Yeah,
becomes
absolutely.
enjoyable and again, paying it forward. And hopefully, when we all leave this earth, it would have been a positive effect on the world, not just ourselves and our families and communities, but in general.
Yeah, yeah, yeah. Thank you for sharing that. And I have one bonus question because I feel like you shared so much and then we have that New York connection. So
Yes.
I want to just ask this one last question. What are you most looking forward to?
What am I most looking forward to? Personally, professionally? Which one?
Yeah, personally.
Personally, um, what am I looking forward to personally? I would love to continue to be able to sleep with the clear conscience every night. I appreciate that. It's understated. I am looking forward to continuing to be able to, or even getting at putting drawing my own line in the sand, to say what I'm willing to do and what I'm not. And that takes courage.
Mm,
That takes a lot of courage in doing that. I've gotten better at it. I think that can be improved. Drawing my own, because we're pleasers, especially again, going back to women, we're pleasers.
exactly.
Right. So being able to better delineate, what I am willing to take on and articulating my terms.
Yeah, yeah. Thank you for sharing that. I think that's something that I know I struggle with as well. So
It's a double-edged sword, right?
double-edged sword. Absolutely.
It's just like which end did you get bitten by, right?
Right. Yes. So this has been a wonderful conversation. Thank you so much for being a guest on our bonus section of Coaching Healthcare Leaders. I can't wait to continue to watch all the things that I know that you're going to continue to do in your career. And I hope that we also stay in touch.
Thank you so much, Dr. Herbert. A pleasure being here. Thank you again for having me. And I know, like you, we'll be doing great, wonderful things in the future.
Yes. Okay. Thank
Take
you.
care. Bye bye now.
Bye.